So COVID hits our country and our community.
How do we respond to that?
We knew that we had to redesign our health system very rapidly to be able to support our community and get through this crisis with them. Since 2018, our health center has gone through a real culture shift using the foundations of lean principles. Two key principles that we follow are respect for people and continuous improvement.
Our elderly patients, even if they're sick or they might be sick, they were very hesitant. They really didn't want to come in because they were so afraid of exposure.
The main foundations of the Desert Sage Way are thinking about the reason for action.
Our patients, when they come to Desert Sage, they want to see the same friendly faces each time they come. 2 years ago, we had a bit of a turnover.
As we were growing, our processes were growing with us. It became difficult to have one person to be in charge of so many things.
We didn't have processes to be able to know if we were winning or losing each day.
It was our intent to be able to improve employee retention.
We did a lot of process mapping. We did a lot of brainstorming, a lot of brain dumping. We tested ideas.
It was quite an investment, in our employees.
I think my mentality was this isn't going to work, or the fear of being told no. We come in here and it's like, your mentality, the answer is yes. The broader or the bigger the idea, the better.
The Desert Sage Way is about eliminating waste.
Sometimes we are multitasking or we're doing different roles, and being able to identify that this person is falling a little behind or this person needs a little help, or I'm available and I can pull some work from someone else and jump in and help where they need it, is a great example on how we respect each other as a team.
And then continuous improvement. Oh my gosh, we move so quickly because we're thinking about how do we improve that process.
I think problems are much more visible. We huddle daily. We're doing a better job of observing and asking questions.
Now we have 65 employees, and we have 65 thinking employees and 65 employees that are giving ideas.
On March 13th, we had the first confirmed case of COVID in Idaho, and that was on a Friday afternoon. And on Monday, we all came into the clinic, and it felt like chaos. We had just more volume than we'd ever seen before, and people were legitimately scared.
The drive-in clinic had been a thought. We just ran with the idea. It's like, okay, a tent's gonna go up. We have parking space. How can we make that work? As we all thought it through, we put out a process. What will this look like? And how can we help our community, help our sick patients, and still keep everybody else healthy?
I have heard many people in the community talk about their positive experience here and that they had no idea that we existed in a way that we do in the community. So it's been a great experience for them.
Now, compared to maybe 3 or 4 years ago, I know our patients are getting reliable and predictable outcomes. When they come in, they know what to expect.
I know that our elderly patients are so grateful for our services out there, the ones that are so high risk.
A new staff member should probably be warned that this is something you've probably never, ever done before.
Likely they've never felt the level of respect that they're going to feel here.
We need commitment and dedication from them.
We want to give care that is predictable, repeatable. It's a standard, and it doesn't matter who's working here. The patient's going to receive the same care.